Well, today, the White House COVID response team gave an update on current COVID numbers. So the current 7-day average for daily deaths is 378. That is almost twice as high as the 200 deaths per day we saw in the spring, but lower than the previous 7-day average daily deaths of 428. CDC Director Rochelle Walensky says those numbers are too high, especially for a vaccine-preventable disease. And speaking of vaccines, late last week, the CDC signed off on updated versions of Pfizer and Moderna's COVID-19 boosters. The updated boosters target the highly contagious BA.5 subvariant. The Biden administration is urging all eligible people in the U.S. to get the new boosters as part of its fall booster campaign.
For the first time since December of 2020, these vaccines, our vaccines, have caught up with the virus.
Doses should start arriving. In fact, actually, I think as of this past Friday, they started arriving. And by the end of this week, over 90% of Americans will live within 5 miles of these new updated vaccines.
And joining us live now to talk more about it is epidemiologist in Kaleida Health, Dr. John Sellick, who we have to mention, Dr. Sellick, this is the first time that we've actually met in person after all this time.
Right. Seeing you in 3 dimensions rather than 2 on the screen.
I know.
Very confusing.
It's a whole new world for sure. So I want to just start with basically some FAQs, because I feel like we've been here before, and you know that the questions are, why do we need another shot? This again, what's going on with this? So help people understand why the old shots just aren't enough anymore.
Well, I think that what we're dealing with is that we know that the vaccines still do a very good job of keeping you out of the hospital and out of the morgue, which is the important part. Preventing infection has been a little bit more problematic, especially when when Omicron in general and then the BA.4, BA.5 showed up. So I think now the addition of the specific mRNA for the BA.4, BA.5 spike protein will give us that additional piece of protection that we don't have with the original vaccine.
And let's talk about who's eligible right now to get the vaccine.
Basically everyone. The Pfizer vaccine is approved for kids over the age of 12, for people over the age of 12, including adults. The Moderna, I think, is still 18. But basically anyone who is 2 months past their either primary series or most recent booster is eligible for another vaccine.
And what about the timeline for children?
For children, for the younger kids, the Pfizer vaccine requires that extra dose in there. But otherwise, once they're completely caught up with their primary series, then the older kids can get it. I don't believe that any of them are approved for the youngest kids yet.
And can people expect the same kind of effects? You know, maybe there's a little soreness at the injection site. Is that all pretty much the same deal?
That should be the same. And the other question that comes up is whether you can get your flu shot at the same time. And the answer is yes, absolutely. Probably best to not get them both in the same arm. But even there, looking at the rate of side effects, it's not very high.
In the clip at the top of the segment, we heard that for the first time, vaccines have kind of caught up to the virus. Is that because we're adapting quicker, or is it the virus taking longer to mutate now?
We're hoping the latter. You know, the Omicron in general and the BA.4, BA.5 have been sticking around for a while now, so we're not seeing that very rapid change that we saw over the first year and a half, 2 years. So we're hoping this particular set of viruses is just so fit for transmission. You never want to say they can't get more efficient, because they could, but by and large, we will probably be dealing with these for a while.
I want to talk a little bit about our behavior as humans, because we certainly have relaxed a lot. You're here, which is a huge thing after 2 years, to be talking face to face. And we've relaxed a lot of things. So for people who might say, I'm good, what's your reaction to that?
Well, I think in general, you know, we're all tired of this, and we want to move on, and I did not wear a mask coming here, and I don't wear a mask when I go to the grocery store. But I think that situations where people are very tightly packed, for instance, we flew to the West Coast a couple months ago. We wore masks when we were in the crowded part of the airport and on the plane. I think especially for people who are immunosuppressed, where we know that they don't get the same level of protection from the vaccine, I think it's important for those people to wear masks as much as possible when they're out in public. But I think we're looking at, even though those death numbers are still a little bit scary, we're not dealing with what we were in the past in terms of hospitals being overwhelmed and large numbers of people becoming severely ill. We're going to continue to see people who are unvaccinated, people who have underlying medical problems, elderly will continue to have problems with this, just like they have problems with influenza and RSV. So we'll continue to see those, and those are the people that we have to be very careful in terms of our behaviors, and they should do the things that they can to protect themselves.
And very quickly, under 30 seconds here, do you think we'll get to a point where we're past this, where we won't have to be getting the boosters anymore?
That would be nice, wouldn't it? I don't know if this is, this may wind up going the way of influenza, where there may be enough changes on a year-to-year basis that we, that we're going to need something. It's certainly not going to be like mumps, measles, rubella, chickenpox, where once you get your couple doses of vaccine, you're done.
Well, we so appreciate you coming in and chatting with us, as always. Great to see you
Great
in
to see
real
you
life,
person.
Dr. Sellick.
That's right. Thank you.
Thanks so much.